Hello, everyone. Today is Friday, July 24th, 2020. I'm Dr. Alex Samuel, Health Director of the Chesterfield Health District, and I wanted to provide an update on the COVID-19 case data that we've been seeing this week and cover a few other hot topics. So with regard to new cases, we've been looking at our new case numbers a couple of different ways over the past week, at least, several weeks actually, and we've noticed an increase in cases that we're unable to account for by administrative reasons like delays in reporting. The 7-day average for new case numbers over the course of this past week has been hovering around 38 new cases per day versus 25 new cases per day around 2 weeks ago. Another important metric to kind of understand increase in cases is hospitalizations. There's been consistency in seeing new hospitalizations over the past week. Not a huge number, but a consistent number. And then another metric that kind of plays into all of this is one that we've been talking about fairly recently, which is percent positivity, which again is a measure of the adequacy of testing resources. Percent positivity looks at the number of positive tests relative to the number of total tests being administered. So the health district is currently showing, as of today, a 7.1% positivity for PCR tests. The goal, again, is to remain below 10%. The 7-day average for the total number of tests administered on a daily basis has been climbing steadily since the first few days of July, actually risen by 35%, which indicates that more people have been seeking testing over the course of the past 3 weeks. To me, this suggests that there are more individuals who are symptomatic and therefore getting tested. So understanding the level of community transmission itself, meaning how much virus is quote unquote out there in the community, is harder to quantify and requires looking at the synthesis of a number of different metrics. Unfortunately, I don't yet have a good way to speak about community transmission. Right now, however, based on the 3 metrics that I just shared, it's fair to say that we're seeing an increase. We're seeing similar trends in other greater Richmond metro area health districts as well. Now, I want to emphasize that this isn't a small thing. These trends they're alarming. Anytime we see a fairly consistent rise in cases, means that by extension, a much larger increase of individuals are being exposed as well. So for typically any single case, we track about 8 people who we consider to be contacts. So that does mean that any increase in cases means there have been a number of people who have been potentially exposed, any of whom could potentially become cases down the road. This virus is very infectious, so we certainly want to give this the due regard that it should have at this point. There are reports from other parts of the country that have been having surges indicate that after 4 to 6 weeks or so, after restrictions have been eased up and return and reopenings have begun, typically they're begun to see an increase in cases. Remember that Virginia entered phase 3 on July 1st, so we're probably within that time frame in terms of the number of cases that we're seeing increasing in terms of an increase. So it's absolutely critical that we continue to do our part to stop the spread of this virus, which again is spread mainly person to person through respiratory droplets when an infected person coughs, sneezes, or talks. It's important to remember that a person can carry and spread the virus without showing any symptoms of the illness. Current estimates are up to 40 to 50% of individuals who are infected don't show any symptoms, which is why wearing face coverings and maintaining distance are both so very important. Understandably, of course, wearing face coverings and the inconvenience that comes with social distancing are making life more challenging. There's no getting around that. These are the only means, however, at our disposal to fight the virus. So I continue to urge you to wear a cloth face covering when entering an indoor public space, and maintain 6 feet of space between yourself and others not living in your household if at all possible. When outdoors, maintain that 6 feet of distance from individuals, again, who don't live in your household. Other measures include staying at home when you're sick, washing your hands with soap for at least 20 seconds, and cleaning commonly touched surfaces. And it's worth reminding everyone that people with COVID-19 can develop symptoms that affect their lungs because the virus targets the lungs. These symptoms can include fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, sore throat, or a new loss of taste or smell. Be sure to contact your healthcare provider for advice if you develop these symptoms, especially after you've been around somebody who's been sick. So I wanted to switch gears a little bit and talk a little bit about hurricane preparedness during a pandemic. So there's no getting around it. We're in hurricane season now. And over the past decade, we've seen an almost yearly increase in the number and severity of these storms. Planning for a hurricane can be stressful under any circumstances. And this year, we're also living through a pandemic, which can certainly make things especially challenging. So I just wanted to spend a few minutes and offer some tips on how to get you and your family prepared, understanding that what you do this year might be different. I'm taking most of this material from the CDC website page, Preparing for Hurricanes During the COVID-19 Pandemic, which you can access off the CDC main webpage, which you can find at cdc.gov. So this year, consider doing the following. Give yourself more time to prepare your emergency food, water, and medical supplies without waiting until we know that a storm is approaching. In other words, prepare in advance. This will help you to avoid a potential run on supplies by others preparing in the last minute, which could result in potential exposure risks with more people in stores this year. Secondly, protect yourself and others by limiting in-store visits to your pharmacy. Sign up for mail order delivery or call in your prescription ahead of time and use drive-through or curbside pickup if available. Third, if you may need to evacuate, prepare a go kit with personal items you cannot do without during an emergency. Include items that can help protect you and others from COVID-19, such as a hand sanitizer with at least 60% alcohol, bar or liquid soap, disinfectant wipes, and 2 cloth face coverings for each person in your family. And finally, and I think importantly, and something that we might not always think about, is if you will be staying with family or friends outside of your household to evacuate in the event you need to evacuate from the storm, be sure to talk to the people you plan to stay with about how you can all best protect yourselves from COVID-19. Consider if members of your household with somebody who is at higher risk, members of that household with somebody of higher risk, including older adults or people of any age who have underlying medical conditions, are present, make sure everyone knows what they can do to keep them safe from COVID-19. Now, there are a number of other helpful tips on the cdc.gov webpage to guide your preparations in advance of a severe weather event. Remember to begin planning early. So I'm going to close by talking about one particular challenge that the health department has been facing, specifically with regard to complaints regarding violations of Executive Orders 63 and 67, which mandate indoor mask wearing and social distancing in certain public places and business establishments. So the health department is being inundated with several hundred complaints about masks and social distancing every day, with very limited staff to process them. A large percentage of these complaints are not violations of an executive order. So in phase 3, most businesses are allowed to open to greater or full capacity with an expectation that social distancing and use of masks are enforced. However, patrons need not wear masks if they are eating, drinking, exercising, communicating with the hearing impaired, receiving government or medical services, or have any medical condition that makes it unreasonable for them to wear a mask. And there's no documentation that they need to carry for that. Business employees need not wear masks unless they are working directly in customer-facing areas. So we simply ask that you please consider whether there really is a violation, or try to address the issue on site with storm management at the time of your observation. And finally, you can certainly vote with your feet. Consider not patronizing businesses and establishments that are not following or enforcing requirements of the executive orders. All right, I'll end there and wish everyone a very safe and healthy weekend. Thank you.